Universal health coverage through the National Health Assurance Mission was one of the major promises of the BJP when it came to power. Now that you've been 2 years in power and you're going to complete the second year on May 26th, how far do you think you've delivered on this goal of universal health coverage, which is a big dream, but you've already gained momentum on that?
First of all, as far as the universal health coverage is concerned, I would like to share with you that last year the Millennium Development Goals ended and the Sustainable Development Goals have started. The national indicators on MMR, the national indicators on IMR, under 5 mortality and TFR. On all these 4 indicators, India has done good. So under NHM, we have been fairly good and we are very close to the Millennium Development Goals target. And accordingly, we are now trying to synergize in the Sustainable Development Goal and we want to go fast. One good thing I would like to share with you is that the pace of reducing the number or the decline in the national indicators is faster of the country than the international decline. So the pace of such a large country, 1.25 billion people, such a big country in a democratic state and in a federal structure, if we are going faster than the international and national decline of indicators, I am fairly satisfied with it. But to add to it, we have taken the components which we are trying to address. One component is universal immunization. And on Mission Indradhanush, we have tried to see to it that taking it as in a mission mode, more than 497 districts of 672 districts have been undertaken in 3 phases. And we have totally immunized the uncovered children, 45 lakhs. And 1 crore 62 lakh children have been partially immunized. That is, they have been brought into the ambit of immunization. So you can understand that it is a great success that we have achieved in the last 2 years, or rather only in 1 year, 2015-16 we have been able to do it. Apart from routine immunization, this we have done. So it is an additional. Those who were left out, those who were not within the ambit of the immunization, they have been brought in. The same way, 45 lakh mothers have been fully immunized as far as neonatal tetanus is concerned, and partially immunized is approximately 23 lakh mothers. So this is also one thing which we have taken into consideration, and it is good. We are satisfied with it. We are going in the right direction.
The issue of universal health coverage, since you had promised that you will roll out a national health assurance mission, and I think the first step towards that direction was the announcement in the budget of a very important scheme of your government that you provide a cover of 1 lakh to every EWS family. How far is that scheme going and what is the way forward for that?
For universal assurance, we are working very hard and we are very much in the target. I'll tell you, we have taken 3 interventions. One is India Newborn Action Plan. Under this scheme, we are trying to see to it that we develop a life cycle approach. And life cycle approach is that the day the mother gets pregnant, from that day we start taking care of all the antenatal precautions which have to be taken. We ensure the safe delivery of the child. We ensure that the child should get all 12 types of vaccination. We also ensure that the child gets the iron and folic acid, and we see to it that he or she becomes adolescent. Till that, the life cycle approach and all medical facilities are given free. Screening is being done. Number 2, we have also under National Health Mission ensured that drugs and diagnostics facilities will be given free till the district hospital level. And for that, the state governments are working very actively. The third and the most important is, although I should have told about it further, that is that we are rolling out an assurance scheme in an insurance model where every economically weaker section of the family, approximately 8 crore families, which comes to about 40 crore members, will be getting on the family basis, a floater basis, insurance of 1 lakh coverage every year with an addition of 30,000 on each individual who will be senior citizen. So this is being done. It will be rolled out in 2017. We are working very hard on it and see to it that it goes in the right direction.
A major challenge going forward is going to be the non-communicable disease sector. Lately there has been a lot of concern around the rising prices of life-saving medicines, especially to cure cancers and variety of other diseases. You have taken a step forward in this direction by opening the store called Amrit, and you've started with some central government hospitals. What is the message for the people? Where do they go to procure cheaper cancer medicines?
Amrit is affordable medicine, a reliable implant treatment. This is a program which we have started and one of our PSUs, HLL, is taking care of it. We started with the first such Amrit outlet in All India's Medical Sciences, New Delhi. Now we propose to open in all central health institutions, and within no time, within a period of 2 months, we will be having an outlet of Amrit everywhere. But we do not want to stop here. We have also given this model to the state governments, and the state governments, if are interested, they will be also undertaking this. This year we have put a provision of 309 outlets. 309 we have said because we need some training also to the people who have to run the outlet. But in this outlet, the cancer drug prices are reduced to 90%. And for implants, the prices are reduced to 30 to 60%. So it's a very beneficial scheme, and we want to go forward. We want to enroll it. We want to roll out to the other institutions. And for that, we have made the guidelines. As the state government comes forward, we will be ready to go forward. And not only that, we have gone for 11 new medical sciences, which is a major step in tertiary healthcare. Not only that, we have gone for National Cancer Center, Jagat. More than 2,000 crore rupees has been spent. Within 2 years, the campus will start running. We are going to double the strength of All India Medical Sciences New Delhi within 2 years. Not only that, we have started 50 state cancer institutes. We have given a sanction. It is in the pipeline, the process is on. The same way, 50 tertiary cancer care units. So, lot is being done. Plan to go forward is one more program we will roll out in coming times. I don't know how that is being. We are trying to see to it that how do we go forward in that direction. And that is about the sensitization of non-communicable diseases. That is most important because these are all acquired diseases. So how we can take care about that?
You have already taken care of the cancer drugs, which are a major component of out-of-pocket expenditure, which is about 70%. And you said free medicine scheme is already being rolled out with states. Another area of grave concern for consumers is diagnostics. You just said that free diagnostics is something you have promised and you're going to deliver. But diagnostics is a vast area. There are a range of tests. Can you explain to us what is the thinking of the government behind the free diagnostics scheme?
It is for the state governments to decide. The district hospitals, what facilities they can give. What facilities do they have? Do they have a nephrologist? Do they have a radiologist? Accordingly, each district hospital we have got a protocol, guidelines. And accordingly, we know that in district hospitals these tests are must. They have to decide. We will give the financial support and technical support is to be given by us. Other things they have to manage. So it is for the state governments now to decide about the drugs. Each state has got its own drug list. Now there are some essential drugs which are needed in the hospital. We are going to give them the financial support. We are going to give them the support for capacity building or for the procurement also. Transparent procurement system also. So that the system is robust. That is what we are going to do and we are going to work on it. But it is for them to do the practical part of it. We will give them the financial support and the technical support. Not only that, this year National Dialysis Program is a very important program where we rolled out the guidelines for it. Each district hospital will get the facility in a PPP mode. They have to go for an MOU with the private partner, give the land and the place and the water and other facilities. The rest will be done by them. And the BPL patients, it will be free of cost. The government of India will be bearing the dialysis charges. And for the APL persons also, we will be fixing the charges which they are going to take.
On the free medicines thing, one of the issues is the revision of the national list for essential medicines. You have done it in the past. Do you propose to also have a comprehensive relook at the national list?
It is a continuous process. First of all, it is done by the Pharmaceutical Ministry. We are partner of it, we see to it. But it is a continuous process. From time to time, essential medicine lists keep adding. Some are being subtracted also. You have to decide at what point of time, which are the medicines which needs essential part which can be taken care. One thing more I would like to say that for multi-drug resistant, bedaquiline in tuberculosis has been provided to the patients. So that is also a very major step. Not only that, it's a 100% center-sponsored scheme that is about the HIV AIDS and tuberculosis patients also suffering because of AIDS. So we have seen to it that more than 1 lakh patients will come in the ambit of our facility to give them free medicines. Those who were having a CD4 count of 350, only they used to get medicine. Now it will be given to CD count 4 up to 500. So 1 lakh patients will be added, and at the same time, third line of treatment has also been started.
Coming to the budget, which is an area of great interest for everybody, because you said earlier on that India is a huge country and addressing health sector and the health sector challenges is not an easy task. How do you look at the performance of the government in terms of budget for the health sector?
I am very much satisfied, and I would like to make it clear through you that there is a wrong discussion which was going on for the last 1.5 years, that there is a slash in the budget. Our Prime Minister is very clear about it. On issues of health, there is no compromise. Whatever budget you need, you will be given. And at that point of time, I also told there were many areas where there was no allocation of budget, but we still said that don't worry, whenever you will need, you will be getting the money. And if you see so, you will find that in last year, 2016, the expenditure has been 96% ever the health department has been able to spend. Number two, always what happens is the budget estimates and the real expenditure. The budget estimates is always more and the real expenditure is less. It is for the first time in history, the budget estimates was less and the real expenditure was more. And we have added to it. It was from 22,000, it went somewhere to 31,000. And last year, if we see, it is 33,000 crores which we have added, which is 39%. I would like to say one thing. This needs a better coordination between the center and the state. And from center, we have been proactive to see to it that the states spend the money in the right way.
Do we, during the tenure of the BJP government, expect the percentage expenditure of the GDP on health to rise from the current 1.4% of the GDP to maybe at least 3%, which is also a promise you made?
We don't discuss this issue in terms of percentage. I discuss this issue in terms of want and need for it. As the need will be there, the central government under Prime Minister Modi ji will be most enthusiastic and most positive as far as allocating the budget is concerned. We have given 900 crores for dialysis. Now it is the state governments to act on it.
Now coming back to the medical education sector, there has been a concern around a lot of corruption in the sector. Medical Council of India has off and on been in the thick of controversy on account of inspections and the way systems are being run in that council. Supreme Court has now constituted a committee to look after its affairs. How do you propose to address this issue?
Before the Supreme Court came with a committee, we constituted a committee on the direction of Honorable Prime Minister and our Secretary Health, the Cabinet Secretary and the Secretary of the Niti Aayog, all three are there. They have to submit the report on the working of MCI and the suggestions of what changes to be brought within a period of 1.5 months. We'll be going forward in that direction.
On the front of MBBS seats, considering we are a vast country, our healthcare needs have been rapidly rising, but there has not been a commensurate increase in the number of medical colleges in the government sector. And because perhaps earlier on in the post-independence period, we may not have imagined that we will have such kind of health challenges coming up, that is why perhaps the government medical education sector was not as robust, which gave room to the private sector to take over. And that is one reason why there is an imbalance. Is there a proposal to increase the number of MBBS seats in the public sector?
Yes, our Prime Minister is very keen on it. We are trying to upgrade 58 district hospitals to medical colleges. We have selected those districts where there is no public sector medical college, government area. We are trying to upgrade the hospital into a medical college. So that is what we are doing, and we may increase the number also. We are thinking on that day. But in the last 2 years, I would like to share with you that 5,540 undergraduate seats have been increased and 1,400 postgraduate seats have been increased. So we are working in that direction, and approximately an approval to 35 medical colleges have been given. We have also increased the PG seats. Initially it was 1:1, one teacher and one PG student. It has been now increased to 1:3, and we are going forward in that direction.
Thank you so much.
Thank you.